I'd just like to start by saying a warm welcome to the listeners that are tuning in to the Me, Myself and Mind podcast. Me, Myself and Mind is a wellbeing company that specialises in mental and physical wellbeing. And I'm Dan Edwards, and I'm joined by my business partner, Dominic Borsbury.
Hello.
And tonight we're joined by special guest, Andy Deekes. And Andy Deekes is a GP and health practitioner, and we're going to be discussing the stress and the strains that's placed on doctors and nurses and the NHS and the mental and physical health crisis that is plaguing our society. So, Andy, if you'd just like to tell us a little bit about yourself.
Yeah, cheers for having me. I'm Andy Deekes. I'm working as a full-time GP locally in Sutton Coldfield, and have been doing so for the past 5 years. So very pleased to be here to have a discussion with you both tonight.
Yeah, mate. And how did you get into medicine?
Okay, yeah. So something that I've always wanted to do as a young lad, but I suppose I didn't take seriously until I was sort of about 16 years old, when you realise the task ahead of you to get into that kind of career. So I started doing some volunteer work and some shadowing work at a local hospital, which whet the appetite. Lucky enough to get a training place at Sheffield Medical School. So I went up there for 5 years, completed my degree before coming back to Birmingham, starting 5 years postgraduate training, and qualified as a GP 5 years ago.
Brilliant.
That's great, Andy. And just a question on mental health at the moment across the UK. Have you personally noticed a massive increase in patients coming in with mental health issues, affected by stress and that sort of thing?
Yeah, I mean, certainly. I think even in my short time of practicing as a GP over the last sort of 4 to 5 years, we're seeing a lot more patients with a whole range of mental health problems: acute stress, mild to moderate and severe depression, anxiety disorders. It's I don't say it's becoming more common. We're just seeing a lot more of it. Whether that's because we're better at recognising the symptoms and people are more prepared to present, which is of course a great thing. But certainly it's putting certain pressures on the NHS.
Mm-hmm. And regarding the pressures, Andy, do you feel this yourself? Is that, who helps the helpers as such? You guys are providing a service, fantastic service in the local communities. But if you're burnt out and you're stressed, how does that affect the day-to-day, operations?
I mean, yes. The short answer is yes. The job is increasingly difficult on a daily basis. I wouldn't attribute the whole burden to the NHS, the mental health crisis necessarily. There are, multifactorial causes, not enough GPs, increasing population, lack of hospital beds, lack of funding for health and wellbeing services. So, yes, we're feeling the strain. Going back to your question, Dominic, what kind of help is out there for us? We've of course got our GPs as well. People often forget we're patients.
Yeah.
And for some time now we've had access to occupational health medicine as well. So services are improving.
That's good. That's brilliant. So we looked at some of the figures for lost days because of mental health issues, and it becomes apparent that there's around 17.5 million days lost to mental health related issues. Not sure, would you be shocked by that? Or
I actually thought it was a lot higher, to be honest with you.
Okay.
I thought it was in the 70 million lost days. I'm not surprised at all.
Yeah.
I'm seeing a lot of patients who are working longer, in more stressful environments, smaller teams, greater burdens of work, lack of support from senior management, not through anybody's fault, but just the way society is at the moment. So it's an increasingly difficult environment for people to be just making it through the week.
Yeah. And we also looked at a little bit of research. It's around 105 billion per year that's affecting the economy because of the mental health crisis, and I'm sure that filters out, as you were talking about before, about the reduction in budget for a variety of public services. That's the police, the NHS, across the board, as it were. What do you think we can do as a society to change that, to possibly turn the tide, or has it gone too far?
I suppose the first thing is to say that the NHS and particularly mental health services needs more funding. It's not currently meeting what is required of it. Yeah. I think the projected spend for 2018-19 on mental health services from the NHS was approximately about 12 million, but the expected 12 billion, but the expected cost actually was about 35 billion. So there's a significant shortfall there, which in part is being picked up by third parties and charities, but there's still a big shortfall. What can we do as a society? I think there are a lot of things we can be doing. We are dealing with stress on an extreme scale. But I think part of what we can do to combat that is look at our own lifestyles and think if there's anything else we can be doing to try and combat some of the stress before it becomes depression. Such as sleeping properly, exercising more, giving our bodies the right nutrition, and that type of thing, really.
And like some of these patients that you're getting on a regular basis, would you say people are, burnt out and they aren't following these sort of health guidelines, and they feel like they are, severely struggling with a category of mental health issue, but they're actually not looking after their own mental and physical well-being themselves on a day-to-day basis?
To make a blanket general statement, I think probably yes, there's always more we could be doing individually. Of course, there's more we could be doing as a service as well. But yes, I think patient expectation is often that they hit a crisis point and they come to see their GP and they are in part expecting a resolution that perhaps should be quicker than it actually would be. What I try and remind people is when I'm seeing them, they've got to think back on how long it's taken to that point in which they've sought my help. Mm-hmm. It's not been a week. It's been months and months and months. Therefore, to get better, it's going to take months and months to get better as well. Mm-hmm. And that's not just with tablets, but that's that has a role in some cases. But lifestyle changes, what we've just discussed, the exercise, the eating properly, the engagement with psychotherapy, counselling services, a magnitude of things. It should be we should approach this problem with as many strings to our bow as we can, and not just prescribe a pill and say off you go.
Yeah. Just on that note, would you say now general practitioners are becoming more flexible in providing referrals? So, as you said, rather than just prescribing a pill, possibly a short-term solution, and providing choice with talking therapists, even possibly personal trainers, and maybe in some regards some alternative therapies, the massage, to de-stress people, that sort of thing.
I believe many of these alternative therapies have a role. The difficulty you've got is what services are commissioned and available to us on the NHS to point people in the direction of. I can discuss the benefits and signpost, but then the onus is very much on the patient to go and look into these things themselves. So it's difficult, but I agree with you totally. There are other things that can certainly have a role in making people improve. Yeah.
Anyone that sort of is struggling, once you've got the answers and once you've got somebody telling you what to do, it is almost then down to you to do those things. And sometimes we don't want to do it. And it's as simple as that sometimes, I've even found with myself before, there's been times where I've got myself down, and for, like you were saying, these things don't happen overnight. There can be a long period of time where you're working too much, sleeping too little, you may not have been eating correctly. And we have to do a lot of work to undo those things. But I've definitely felt the strain of you almost feel like you want rescuing. But once you've got those answers, and once you've realised what you've got to do, it is your work that you've got to put in.
I agree. It's exactly the same as when we first started training together, Dan. One of the first things I said to you in our first sessions was I used to struggle with a little bit of lower back pain as a product of spending 10, 12 hours a day sat at a desk, not mobilising, not moving, stiffening up. And it took, we've been training about a year. Yeah. It took at least 6 months for things to start to improve. The mind is no different from a muscle. It takes time to recover. You've got to do the right things and do them repeatedly and change what you're doing in order to get a different outcome.
Definitely. Just listening to that, it resonated, because on the way here we were talking about possible social media usage. You know, is that encouraging man, woman and child to have instant results, instant gratification? And as you're saying, it takes time to build something, you know, to get fitter, to get stronger, and to alleviate some symptoms. You know, if you've been doing something for years, eating the wrong foodstuffs or not exercising, then it's going to have a detrimental effect. What do you think about social media? Has that a negative contributory factor to this?
I think so.
area?
I think so. I think we are constantly plugged in these days. I know personally, the go-to thing when you've got 5 minutes of freedom is to check on your phone, see what's going on. It's a habit. It's something that we all do. The problem with that is you're one click away from seeing how apparently wonderful everybody else's life is, and you're making very quick comparisons as to how yours is not. And I just think it creates a lot of resentment. It makes people very unhappy. And I think we're looking for gratification in the wrong places sometimes. You know, we're looking for how many likes we've got on a post, or why didn't such and such comment on this picture. And I think we're at danger of not realising the difference between reality and what's portrayed on social media.
And, you know, on our last podcast, I was speaking with Callum and Josh Mayer on this subject. And these pictures that people are posting, and we've all done it. You post a picture of yourself on a beach or on holiday, you know, living my best life. And we spoke about this, and people have got to realise that that's what other people are doing. They're posting the highlight reel of their life. That's not the day in, the day out, the harder times. And then you'll have people that, you know, could be struggling themselves with their self-esteem, their confidence, or where they want to be in life, or, you know, with their, you know, mental or physical health. And then you have them comparing themselves to Wonder Woman or, you know, a model on Instagram, and it's just not reality. And
it happens outside of social media as well. I'm aware of a colleague who was, I obviously can't go into too much detail, but had a patient of hers comment that, oh, you're okay, doctor, you're living the perfect life, everything's great. But obviously little did she know, my colleague was going through a very difficult time of things at home, actually, and the outward projection in her professional role is no reflection at all of what's going on internally and at home. And that's exactly what you're seeing on Instagram. You're seeing the highlight reel.
So I think talking about the virtual connection or virtual communication we're having, as you said, it's falsifying society in a way. You know, we're hiding behind this perfect mask. And I think we've discovered through me, myself and Mind, it's opening up people's, you know, communities and getting people to come forward and talk, you know, about the feelings. What do you think about that, especially with the mental side of health for men? What's your opinion on that?
I was going to say, you know, we shouldn't view social media and the internet as all bad. I think it's doing a lot of good as well. Definitely. It is connecting people. And I think part of what we're seeing, you know, we label it a mental health crisis. I don't necessarily think there has been a huge increase in incidents. I think we're just a lot more prepared to talk about it now. And I think seeing people, you know, such as the posts that go on Me, Myself and Mine, gives people the confidence to talk about how they're feeling, recognise that it's okay not to feel okay all the time, and are much more happy to come forward and speak about it. So I don't think it's all bad.
Yeah, and we did speak about that on the last podcast, that, you know, we don't want to demonise social media, because if we didn't have social media, for example, we couldn't connect with the vast majority of the people that we do, because some people you don't even know, and you can be putting out posts that can improve somebody's day, and you wouldn't be able to do that without the power of social media. But it's almost taking responsibility for your social media usage, because it's so easy to get wrapped up in this comparison, and it's so easy to get wrapped up in that addiction of wanting to keep going on it, that you've got to use the technology and not let the technology start to use you in that sense.
I agree with that totally.
Good point. Also on that area now, what we're finding, there was a quote some time ago from Matt Hammond, Health Secretary, and he spoke about social prescription. Could you talk a little bit about that, Andy?
Yeah, certainly. I mean, it's something that we have access to in Birmingham, where I work, in my locality. I'm not sure how far that has spread elsewhere, so I can't say, but so far I think it's been a very good initiative. The premise and idea behind a social prescriber is is that we have a worker that comes into the practice once a week, twice a week, whatever's needed, sees our patients that perhaps doctors are struggling to manage from a medical point of view. There might be, issues such as loneliness or low-level depression, that type of thing that, medicalisation isn't necessarily the answer. What they will come in and do is spend a good hour with patients, really sit down, get into the crux of how they're feeling, what they can be helped with, whether it's putting them in contact with art classes or yoga classes, whether it's supporting them with DWP applications or housing applications. They do a magnitude of things, and I think it's a very good service to take some of the pressures off us in a way that pressures that we can't help with.
And I feel like sometimes as well, it's just a helping hand. We all need a helping hand at some point. And for those people that don't have it, I think something like that it is definitely a great thing to have.
Sounds fantastic.
Anything that can engage people and get them up, moving, engaging with
other people.
Exactly.
And, to bring it back to the whole social media thing, we are becoming very social media dominant. Too much social media and not enough real connection. And then, this whole social prescription gets us out of our comfort zone. It gets us engaging with individuals we might not have even met otherwise. And definitely that.
It's, the difficulty is that there is a lot of stuff out there, a lot of, resources available. The difficulty is knowing what's out there, as we mentioned earlier, really. I know things exist, but knowing how to access those services is a different story because there are so many of them. Something like a social prescriber that have an acute awareness of what there is in a locality that will not just simply signpost but actually ring these classes up, ring these people up and get you engaged with them straight away, I think is great.
Sounds really good.
And
sorry, go on.
Oh no, sorry to cut across.
No, carry on, Dan.
I just didn't know whether you wanted to mention that that study by Waldinger.
Yeah, we looked at a study. It was around 79 years by Dr. Robert Waldinger, looking at people's health and happiness. And he found there's quite an astounding fact that when he looked at these people at the age of 50, how satisfied they were with their relationships was a bigger predictor of their health at 80 than actual cholesterol markers within the blood. It wasn't the fame, the money, or the job. It was that social support that they all had. And one of them that he found out within the study was that loneliness is a bigger killer, he stated, than alcoholism. And I think there's some studies there, I'm sure you'd agree, possibly that it can bring about strokes and heart attacks.
I think there are certain basic needs that we're aware that human beings need. We need warmth, we need food, we need water, we need shelter. But actually it's a little bit deeper than that. We're social animals. We need to be accepted. We need to have established these, really quite complex social interactions and hierarchy within our society. And I think when you don't have that fulfillment, I think it does start to manifest in physical health problems. So I would agree with that totally.
Definitely.
I was just going to say regarding that, to change that, to get a real positivity, we looked at exercise before. I know some branches, gyms within the West Midlands area some time ago gave out free passes. What do you think of that, to encourage people to exercise? Because you mentioned that on the way here, didn't you, about the quickest way to change your mental state is through exercise. What do you think of that?
I mean, certainly for low level depression, I think exercise is definitely underestimated as a treatment. Really, it's been shown to be just as effective as antidepressant medication. You're absolutely right. We used to have exercise and prescription schemes and that type of thing. Unfortunately, with years of austerity and cuts to funding, we don't quite have access to the same sort of thing now at the moment. So, I think the better we can do to get people moving. As a GP, I'm moving more towards we should be doing more preventative medicine rather than being reactive. We should be doing more to stop these things developing in the first places. And I think exercise and nutrition and well-being, I think, is an important part that is just not utilised enough at the moment.
But I can almost sympathise with, when people don't exercise. I mean, even within myself, and I don't know whether you guys have found this, that if you take 3, 4, 5, maybe 6, 7 days out of a gym, you lose that momentum. And it's that momentum and that drive and that knowing that when you go to the gym, when you come out, you're going to feel so much better. And once you start going the gym again, it might take another week to build momentum back up to then enjoy going back to the gym. So I almost empathise with people who have never been involved in exercise because they've never built that momentum in the first place. So, you know, to be told to go and exercise, it might seem like another world for them. And also they might have this like resistance that, I mean, even I've felt, and I'm a personal trainer. So yeah, I really do sympathise for people. And I think it could be about maybe going with a friend.
Yeah,
you know.
Even more than that, really. I think again, social media. You think of fitness, you see these huge, ripped, ultra fit people that are in the gym twice a day, 5 days a week, and you stand at the bottom of the hill and you look up and think, I will never attain that. But you know what? Getting off and going for a 10-minute walk twice a week is better than doing nothing. You know, we should be looking for 1% improvements per day. You know, we shouldn't be looking to change 180 degrees in our lifestyle in one go. You know, if you can't do 5 press-ups, well, aim for 5 press-ups. If that takes you 6 weeks, fine. You know, the next 6 weeks aim for 10 and slowly build things up.
And I think it's, you know, adding small things in daily, like you were saying, like that might be a massive mountain to climb to go to the gym or to go on a massive walk 2-3 times a week. But I mean, even in the office on your lunch break, people could, you know, get themselves outside, take a small stroll, even, you know, it clears your head.
Take the stairs instead of the lift. You know,
Exactly.
these small changes add up and they compound. If you start to do them regularly, you will notice a difference in your well-being. Absolutely.
There was something some years ago, I can't think of the government initiative they brought out. It was for childhood obesity, if you remember. You know, the healthy choices, they brought that out. That made a bit of an impact, you know, on society. But sometimes it feels though it's flavour of the month. It should be ongoing. As we said, you know, life is ever changing. So it's to keep, you know, these initiatives, as you said, preventions. What do you think they could do to bring out in linking what we're talking about, childhood obesity? That's quite a big one. Because obviously they grow up into possibly unfit adults, unfortunately, with the junk food. How do you see junk food, and where does that come into local communities?
Yeah, I mean, diet has a huge impact on not only mental well-being but also just overall morbidity and mortality. We're fueling our bodies with the wrong foods. It's creating inflammation. It's making us sick. But it's hard to pull away from that. Advertising, it's rammed down your throat all the time. You want to make a healthy choice, well, okay, on the go it's going to cost you twice as much as an unhealthy choice. You walk into a shop for your lunch and you're just immediately faced with packaged sandwiches and bags of crisps and chocolate there. It's a real problem, and that needs to change society-wide, really, because we are telling people that they're fat, that they're lazy, and then doing everything we can to sell them the junk that's going to make them that way. And it's really counterintuitive. And
I mean, you've got that where you're being bombarded with these advertisements of junk food and it's being glorified. But I seen this quote when it said that, and, you know, I don't know how true this is, but it was saying that, you know, it's not diseases that run in families, it's eating habits.
Yeah, I think if you're a child of obese parents, then you are significantly increased risk of being obese yourself. It is again comes down to social dynamics. We learn, we watch, we learn, and we copy. If we're taught to eat in a certain way by our parents, we'll do exactly the same. And that's not to blame parents necessarily, because as we've talked, you're fighting against big corporations and convenience and stress and lack of time, working longer. You know, it's difficult, but you're absolutely right. And
you're right there, Andy. That's some real valid points. I mean, if you look at the highest echelon of athletes, sporting prowess, McDonald's, Coca-Cola sponsor them. You know, so it's crazy, it's a bit ironic.
Crazy.
You know, this happens.
One thing I wanted to ask you is, have you or do you know any other GPs that are starting to track sleep of the patients that are coming in to see you guys?
It depends what you mean by track. We'll often have a conversation about the importance of sleep. Sleep is very important, not only quantity but quality. And again, just through the stresses of life, people aren't sleeping enough. and it's having a knock-on effect. It only takes a very small reduction in sleep each night to start to have a significant impact on your mental and physical health.
Yeah, definitely. And I mean, again, I know that if I've got those early clients and I haven't been to sleep so early the night before, it definitely has a massive knock-on effect on how I feel that day. So if you end up getting into that routine of going to bed late, getting up early, and you're not getting those, full, 6 to 8 hours, then it could, possibly be really damaging your health.
Absolutely. There's I know we've talked about it before. There's an excellent podcast with Joe Rogan, and I forget the chap's name, but he's basically a PhD doctorate chap talking about the importance of sleep and sleep research in America. It's really fascinating, actually. The effects of even minor disturbances on your sleep and the overall effects on your projected health outcomes later in life is incredible.
Definitely.
Could be catastrophic, couldn't it?
And I mean, again, I've done this. I've lay in bed of a night and I've scrolled through my phone on social media, and you might then start comparing your life to the lives of others, and then that sets off a whole cascade of stressful thinking about your own life. And if you're trying to get to sleep and it's 10 o'clock at night, when you're scrolling through your phone and that starts happening, it's not the best way to start settling your body down and to start going into relaxation mode. And the phones and the televisions, they emit blue light, and that's on the same sort of spectrum as the morning sun. So if we're not allowing our bodies to produce melatonin and make us feel tired, then surely those those disturbances in sleep are.
I think it's important to think about what you're doing, what your sleep routine is. If you're someone that struggles with sleep, you need to be looking at what your whole approach to it is. You need to be turning off all your screens at least an hour before you want to go to sleep. Also, turn the lights off in the house. A lot of people that leave the lights on. Actually, when you start to dim the lights and turn them off, it causes a spike in your melatonin. So if you do that for an hour before you go to bed, you're actually starting to feel sleepy purely because of the change in light. Regularity. I can't stress enough the importance of doing the same things, going to bed at the same time, getting up at the same time, whether it's midweek, whether it's weekend. Routine is key. Keeping yourself cool. The brain temperature actually needs to drop a little bit for you to get a good night's sleep, so keeping cool at night can be very useful. Some people struggle with lying in bed, and the old advice was to sit there and count sheep until you fall to sleep. Actually, what's better is to remove yourself from the situation. If you're in bed lying there and you know you can't sleep, it's actually better to remove yourself from the bedroom, go and keep yourself occupied for half an hour downstairs, do a bit of ironing, something, then take yourself back to the room and try and sleep again. Don't just lie there, because it becomes even more difficult for you to fall to sleep.
That's invaluable advice. Look, towards sleep, obviously, it's about hitting the sympathetic nervous system, because we're looking at these phones, getting excited before bed, as you said, not to look at them. What do you think of the other side of meditation, guided meditation, that sort of thing to calm people down? Have you had any experience of that?
No personal experience. I've not enough to comment on, but from speaking to other people, I know you're an advocate of meditation, Dan. I can only see the positives. I think taking a little bit of time to look inwardly, assess the day, what goals have you hit, what haven't you, what can you do tomorrow, just taking a bit of time to plan the day a little bit, what do you want to achieve, I think can be really useful.
I mean, even on that, it's not a meditation as such, but we did a talk recently on gratitude practice, and it goes with what you're saying there, that if you spend a few moments, and this can aid sleep, that if you start spending 5-10 minutes before you go to bed, thinking about those things that went well during the day, those people, those things within your life that you're actually grateful and happy to have, you tend to find yourself getting into a more relaxed state than if you start stressing yourself out thinking about the things that didn't go so well.
And didn't you look at a study on that as well? There was some factual information.
It was a study done where these people that practiced the gratitude before bed tended to sleep a lot deeper and for a lot longer. Definitely that's...
Yeah, I think just a little bit of headspace is really useful before bed. I think, when we have a number of things on our shoulders hanging above our heads, tasks that need to be done, work that needs to be completed, I think it's easy just to try and push them to the back of your mind, and they start to build up and seem a lot more significant than they actually perhaps are. And I think just spending a bit of time rationalising it and making a plan of how you're going to hit them tomorrow, how you're going to achieve the goals you want to, I think just removes a lot of the stress and anxiety about things straight away.
Definitely. And I mean, I'm sure we've all felt that, you know, when you think of a negative situation, one stress turns into 2 and 3, and then you find yourself stressing about something that didn't even need the stress. I mean, have you ever experienced that yourself?
All the time, to be honest with you, all the time. What I tend to find is I always leave things to a deadline, and I let them build up, and then I sit down and do them and think, actually, that took me 10 minutes. Why didn't I do it and remove the stress when I first had that task? But that's something I've always done.
I suppose, like, you know, if you do that with the bigger things, that's how easy it can be to start letting things get on top of you, you know, like what we're talking about. When people feel all of the pressures coming all at them all
and then you
once.
feel guilty because you've had plenty of time to complete these things and you haven't done, and then you're rushing tasks, things aren't getting complete to a standard that give you fulfillment, and it knocks on.
Yeah, but we're all human, you know.
I mean, we're also looking at things to calm us down. What about spending a lot more time in nature, Andy? Do you ever suggest that to your patients?
In terms of when I talk about exercise, we're very lucky. Our practice is right on the border of Sutton Park, so I can very easily say, you see that beautiful park over there with all the trees, go and spend some time in it. It is. There's no doubt it'd be useful. There's you know, there's been well documented and discussed the benefits of spending time in nature and for well-being. I'm sure you've probably looked into it a lot more than I have done.
Definitely. Well, spending time in nature actually allows us to become more mindful. And when we're being mindful and in the present, we can't sort of focus on those stressors of daily life. So when we are spending more time in nature, that being in the now actually becomes that form of de-stress. So yeah, definitely it can really impact our well-being. Just getting out and about and getting some fresh air.
You just want to be doing things that break the thought cycle. You know, if you're in a place where you're feeling anxious and stressed, you need to remove your brain from that thought process somehow, whether it's exercise, whether it's getting involved with nature, whether it's attending a local art class, whatever it may be. Giving your brain something else to focus on gives it time to de-stress itself, and you'll probably find when you come back to the problem that you had previously, it's a lot more easy to deal with.
Yeah. Rather than this Christmas period, everybody's out shopping, aren't they? I mean, there's so much pressure today to shop 24 hours. Absolutely. And to get out there, but people aren't actually mixing. Me and Dan the other day, we were sort of around Tamworth and noticing the people, and people look glum. You know, it's Christmas and they're buying presents, but they didn't look particularly happy.
No joy. It was a task that needed to be done. I was doing it myself this morning, and I walked past people that were saying, "Oh, my kids are terrible to buy for. I've had such a stressful time." I think we're kind of forgetting what the point is. We're just driven by consumerism. We're swiping the card and moving on as quickly as possible.
And then I think that can be a massive stress for those people that are less fortunate at Christmas, because then do they then compare their lives to their friends and the other families that, you know.
Well, you've seen people post online the Christmas tree with presents piled up to the ceiling virtually, and you have a laugh. But I would imagine that a family that can't afford to do that for their children are looking at that thinking, God, I must be a bad parent. You know, this again, social media is not a good place to be putting these things out. What you do at home, fine, but I think people need to take a step back and think of sometimes people that are less fortunate, but the overall impact and effect their projected opinions are having on people.
And I think the consumerism has gone too far, and really Christmas should be about spending time with loved ones and becoming connected to those people around you, and starting to feel that love for people. It's not for the presents.
I agree with you, but my opinion on that is it can be whatever you want it to be, but don't project it on everybody else. Is what I would say.
Definitely. I think what we're looking at is needs and wants. You know, people want that. Do you necessarily need it? And going back to the adverts you were talking about earlier, Andy, they're projecting it to us, to all of us, to say, you should be having this. You need the latest pair of trainers or whatever it may be. So people are hankering after these material possessions, and if you haven't got them, looking around, as you said, on social media or even locally, you feel that you're a bad parent because you haven't bought your children the latest toy. I mean, I'm not sure how much the iPads are now, but children as young as 4 or 5 are being bought iPads, and there was a family member of mine joked that that their children had more fun playing with an empty cardboard box than a £500 plus iPad or whatever they are. So maybe we're conditioning them from such a young age, but I would say personally that possibly the bigger companies are targeting the youngsters, so they've got a loyal follower, for life.
I'm absolutely sure that they do.
Yeah.
I said to my fiance the other week, I was at home with my little girl who's 15 months old, and we were watching her cartoons in the morning.
Yeah.
And obviously around Christmas time, all the adverts are coming on for all the kids' toys, and I found myself sitting there thinking, "Oh, I'd like that. I'll play with that. What am I doing? This is a toy for a child. The marketing is so clever that it just makes you want it." And I was like, "It's ridiculous. It's a doll's house."
Yeah. But you get drawn in, don't you? And again, that's it's television, and myself personally, I haven't got one, but that's my choice. These boxes in the corner, as my mother used to call, the devil in the corner, as it were, from many years ago. They're projecting this out to society, and people are following them, especially youngsters.
Yeah,
because they're hankering after all of the toys, etc. And maybe the morals and the values are getting diluted, possibly.
Yeah, I think so.
Yeah. So, just to, finish it off, would there be, 4 or 5 tips that you could give the listeners to take away with them to, start improving their physical and mental health themselves?
Yeah, I mean, the first thing to say, that if we're talking about take-home messages, the first thing to say it would be, if you're struggling, speak up. All right, don't be hesitant to go and speak to your GP or present to A&E or healthcare professional. That is what we're there for. And although this gets labelled as a mental health crisis, I think it's great that people are coming forward and taking notice early. But there are things that we could be doing ourselves to improve our well-being overall. If it's 3 things, I would say: sleep more, exercise more, and look at what food you're fueling your body with. If you're fueling your body and your mind with the proper nutrients and correct foods, you're much more resilient against illness, you're much more resilient against mental health problems, and your recovery is much better from any of these stresses in life. Sounds very simple.
It's so simple, but it works.
Yeah, it does.
But no, brilliant.
Fantastic.
Thank you for that. Thank you for joining us.
Thank you, Andy.
Cheers.
Brilliant.
Cheers.